Well, we are, as you all know, in the middle of an active war. That's an active military action that's happening daily, and that is compounded into an acute displacement of more than 700,000 people in a few days. Today, I was checking the news. There is also a warning to evacuate a major coastal town in the south, which is Sidon. And that's happening also in the context of other levels of economic problems and fragile health systems. But being in a cyclone of repetitive wars and crisis, I think we came to learn probably a very efficient way of coordination that rests on three things. The first one is the serious commitment and the stewardship of the Ministry of Public Health and the government towards sexual reproductive health. And that has been reflected as integration in the way services are being delivered and not like something vertical or standalone. And that's happening across the extensive network of the primary healthcare services across the country. The other important thing also that we have learned is the close coordination with the UN agencies and the immediate, of course, utilization of the MISP, as Nadine mentioned, with the strong support from UNFPA and other organizations. And that means we immediately consider that reproductive sexual health are part of the essential services because we believe pregnancy will not stop, childbirth will not wait. So immediately on the top list of the services are the reproductive health, from pregnancy to childbirth to postpartum to family planning to STI prevention, and of course to the GBV. We have also units that will deal with violence survivors in most of the shelters with people, which is very new now under the National Mental Health Program. And also we ensure referral pathways. The third and most important thing is, so there is a stewardship, there is decentralization in the sense of engaging everybody. The academics are engaged. I'm sitting here. We have continuous meetings at the university on how to make sure the quality of care, how to make sure that nutrition, water, kitchen, medical service, public health are all happening in a coordinated way. So the third level is the local engagement. We have a very strong community. Municipalities are engaged, local workers are engaged, social workers are engaged, even health professionals and providers who are in their cities. There are also mobile services because displaced people keep on also moving. So we have a very strong mobile services that are connected to protected referral pathways. So we ensure that sexual reproductive health is being delivered in a quality way. And that's why in the last war, 2024, which is the recent one, and protracted with the daily strikes, we maintained really very encouraging indicators in relation to reproductive health because everybody is engaged and there is a lot of flexibility in going from the center to the periphery to the shelters and working in a very mobile day-to-day kind of work. What we need is we have to stop feeding the monster. See, we are public health agents. We work against our mandates. We deal always with the consequences instead of dealing with the prevention as a public health people. We have to prevent wars. We need peace. You see, peace should be there. Otherwise, you're gonna have this money and feed the monster all the time. Of course, saying this, definitely there is a global underfunding. Definitely, we need these funds. One, to support the displaced at the humanitarian level, at the nutritional level, at the security level. That's very important. Well, the government is working left and right to get these funds. The UN agencies are trying also to provide some funds to the existing work. There is a huge need for this acute displacement in terms of shelter, in terms of food. Uh, Over the past tens of years, we have really been able to create a cadre which is very competent to provide services and to work within public health because we engage everyone, academics and otherwise. But definitely, when the problem is overwhelming and the monster is eating everything, of course, you will need every support possible and every funding possible. Thank you.